Introducing tonight's speaker is Dr. Duncan. Dr. Duncan is from Interior, the ADHD clinic, and it is funded by the Ministry of Children and Families. Dr. Duncan will share his expertise in ADHD by describing how the ADHD brain works and what's important to know about ADHD. And we all want to know about that because most of us have kids, obviously, with ADHD, and I myself do. So I'm looking forward to hearing your expertise.
Well, thank you. Thanks for having me. You have ADHD. I'll try to be entertaining to keep your attention and then be easier for you to focus. Looking forward to tonight, and we are going to welcome questions. As I understand, we'll obviously save all the questions for the end of the talk. I've been asked to speak for about 45 minutes. Which of course is a challenge. I've been both looking forward to tonight and been a bit nervous about tonight. Nervous not about speaking. I do lots of speaking on ADHD across the country to physicians, teachers, parents. What I'm nervous about is this usually is a topic when I'm speaking to parents that's about a 3-hour talk. So I've got 45 minutes to do a 3-hour talk. So I am going to speak very quickly, and I'll ask you to listen very quickly. And we'll get through it together. So the challenge for me tonight is not what to say, it really is what to leave out. So I look forward to the questions, which will provide obviously an opportunity to fill in the blanks if I have failed to address what you're interested in hearing about. So we're going to talk about ADHD, obviously. It's a disorder, one of the most common childhood psychiatric disorders, as you'll find out. But unfortunately, still very much misunderstood. This is a disorder associated with significant myths and misunderstandings propagated by articles in the media that you've heard about. Many of the myths I'm sure you've heard. I wouldn't doubt if you probably find yourself still believing some of the myths. The challenge is, given the air coverage we get on ADHD and the distorted views, it's sometimes difficult for parents to tease out what's facts and what's not fact in terms of talking about ADHD. So I'm hoping as we talk about the scientific facts associated with ADHD, many of those myths will just be dispelled. So we'll be covering what ADHD is and what it's not. What is different about the ADHD brain? What is it that makes ADHD what it is? And I think you'll find as we talk about that, some of the confusing parts of ADHD will make sense to you. We're going to talk about the cause of ADHD or causes associated with ADHD and try to dispel some of the myths associated with that. And then we're going to talk about some other common problems that are very frequently present when an individual has ADHD. And then we'll finish up by talking a bit about treatment. I'm sure there'll be lots of questions around treatment, why it's treated the way it is, and then we'll get into specifics as you're interested. How common is ADHD? Well, it is common. No, everybody doesn't have ADHD, but it is, as I said, probably the most common single psychiatric disorder in childhood, and one of the more common ones in adulthood as well. You'll see on the slide here an indication of how frequently it does occur. In any given classroom, there should be 1 or 2 children on average who have ADHD, and there's 2 kinds of kids depicted here with ADHD. One is the typical traditional child with ADHD that we all think of when we think about Attention Deficit Hyperactivity Disorder, that is the hyper kid. But there is another group of children with ADHD that have no problem with hyperactivity or impulsivity, that are simply easily distracted, inattentive, have difficulty focusing, and maybe somewhat underactive. And those are kids that are very, very commonly missed in terms of assessment and diagnosis, because we tend to, unfortunately still, notice kids who are a problem rather than kids who are having a problem. And our school systems still tend to focus on and bring to the attention of healthcare professionals children who are causing problems in the classroom. And those kids who aren't causing a problem but are still having a problem may go unrecognized. So about 6%, the best research shows, about 6% of kids and about 4.4% of adults have ADHD and should be diagnosed. So I do a lot of speaking with physicians. I ask them when I speak to a physician group whether they find that 1 out of every 15 kids in their practice and 1 out of every 23 adults in their practice have been diagnosed with ADHD, and I have yet to meet a physician who can say yes to either one of those questions. Contrary to popular myth, ADHD is not overdiagnosed. Well, maybe Dr. X overdiagnoses it, I don't know, but generally speaking, we tend to miss ADHD rather than more often than we diagnose it. It is relatively common, but very commonly missed. In fact, here's what the research shows. We know what the Canadian population is. We know that about 6% of kids and 4.4% of adults have ADHD, so we can estimate what the ADHD population is in any community. In Canada, you can see the numbers there, but we know from the research that about 2/3 of kids who have ADHD go unrecognized as having ADHD. I commonly hear people say that they don't like their children to be diagnosed with ADHD. They would rather kids not be labeled. I'm sure you've said or heard that yourself. The fact is, if you know ADHD at all, you know kids with ADHD get labels. ADHD is one label, which simply means that there's a reason for the difficulties. If it's not ADHD, they may have other labels attached to them: brat, delinquent, lazy, unmotivated, irresponsible, need better parents, need better teachers, etc., etc. The fact is, ADHD is associated with difficulties, and difficulties end up being labeled one way or another. ADHD is a medical diagnosis. It's a label that means there's a reason for this child having these difficulties. So we know what the rate is. We know that it's usually undiagnosed in kids, almost always undiagnosed still in adults. So when we look in BC in particular, there's probably about 70,000 individuals in British Columbia that have ADHD and have yet to be recognized as having ADHD. They are, by definition, as we'll see when we talk about the diagnosis of ADHD, struggling. They are having difficulties in their functioning, but it's not being recognized that ADHD is leading to that problem. Here's my so what slide. So what? Why diagnose ADHD? Who cares? Everybody and their dog just wants to concentrate better. This is a yuppie disorder. Not the case. ADHD is associated with significant problems. All of the things you see on the slide right now are more common in individuals who have ADHD than they are in individuals who don't have ADHD. Early pregnancy, substance use problems, difficulties with the law may be more common. Difficulties with driving, increasingly being recognized. Don't tell ICBC that. I too have ADHD. I have kids with ADHD. You can call up ICBC and mention my name. They'll know who you're talking about. I had 3 motor vehicle accidents in one day, so if anybody needs a ride home, I'd be happy to give you one. Healthcare costs are higher in individuals who have ADHD. Interestingly, healthcare costs in family members of people who have ADHD are twice those of individuals who don't have family members with ADHD. And that's unrelated to the cost of ADHD itself. ADHD is associated with difficulties and stressors, and that impacts individuals' lives, both with ADHD and the lives of those around them. And as we'll talk about in a bit, some psychiatric disorders and other difficulties are more common with ADHD as well. Clear up another little myth here. There isn't a difference between ADD and ADHD in terms of the disorder. It is now all called Attention Deficit Hyperactivity Disorder. It used to be called ADD because the term used to describe it and diagnose it was Attention Deficit Disorder with or without hyperactivity. We'll talk about the criteria for diagnosing ADHD next, but it's important to highlight that symptoms of inattention and symptoms of hyperactivity and impulsivity are all part of ADHD, And it's not uncommon for individuals to have ADHD and have no problems with hyperactivity. Again, one of the myths out there is that if you're not hyper, you don't have ADHD. ADD, ADHD, it's all called Attention Deficit Hyperactivity Disorder. This slide also highlights a bit about the origin of recognizing the disorder. Back in the 1930s, physicians recognized that there were a group of adults who experienced a brain infection, a viral brain infection, and then recovered from it. So they had a viral encephalitis, an inflammation of their brain, and when they got over that, they all had a number of symptoms. They had difficulties focusing, they tended to be a bit impulsive, and they were more active than they had used to be before the brain infection. So this post-encephalitic syndrome that adults had got them to thinking, we know some kids who have those same difficulties. It hasn't been evident that they've had brain infections, but they've got the same symptoms that these adults have who have recovered from a brain infection. There must be something going on in these kids' brains that's causing the problem. So they used a generic term, minimal brain damage, later to be called minimal brain dysfunction, and then over time all psychiatric disorders developed specific criteria that had to be met in order to diagnose it, and so you can see the evolution of the names that have come about as a result of increased research about the criteria that are required to make the diagnosis. So again, early on it was recognized as being a problem based in the brain, similar to other adults who are having different difficulties. Here are the official criteria used to diagnose ADHD, at least an overview of the criteria. Anybody who diagnoses ADHD, whether it's me, a psychologist, a pediatrician, a family doctor, are going to use these criteria to determine whether somebody does or doesn't have ADHD. You can see that there are 5 criteria here. Number 1, you have to have symptoms of inattention and or symptoms of hyperactivity and impulsivity. So those are 2 groups of symptoms, important to point that out. Inattention, hyperactivity, and impulsivity. And so there are 3 kinds of ADHD. ADHD inattentive, meaning you don't have problems with hyperactivity and impulsivity. ADHD hyperactive impulsive, very rare, may not exist, but that means you don't have problems with inattention, only hyperactivity and impulsivity. And then what's called ADHD combined. ADHD inattentive used to be called ADD. So that's where the confusion sometimes comes. So you can have 3 different kinds of ADHD, depending on whether or not you meet the criteria for inattention and or hyperactivity and impulsivity. This is a point when I usually ask, is that clear? But I'm not going to get your feedback right away, so I'll just move on. There are, and we'll go over them very briefly next, 9 symptoms of inattention that we look at and 9 symptoms of hyperactivity and impulsivity. And in order for you to meet criteria 1, you have to have 6 out of 9 of the symptoms of inattention or 6 out of 9 of the symptoms of hyperactivity and impulsivity, or both. Also true has to be the fact that you've always had it. Technically, it's before the age of 7. The next iteration of the criteria will probably say before the age of 12. The point is, if you have ADHD, as we'll see later, you were born with ADHD, and so the symptoms should have been there early on. ADHD that appears at 24 is not ADHD. Now, caution, it may first be recognized at the age of 24, if you're lucky, rather than 72 or 56. But it should have been present, even though it's recognized later, it should have been present all along. It has to occur across situations. Again, ADHD that's only there at school is something about what's going on at school. It's not ADHD. Another caution, it is very common, almost typical, for ADHD to cause more problems in some settings for an individual than in other settings. So it may be more of a problem at home, or more of a problem at school, or more of a problem out in the soccer field, but some evidence of challenge related to inattention and or hyperactivity should be present in more than one setting for us to consider this ADHD. The 4th criteria is that it has to be causing an impairment. Those of you who are Star Trek fans know that Spock said, A problem that is no problem is no problem. And that applies here. If you meet all of these criteria, but it's not interfering with your functioning, we don't call it a disorder. We just say it's an interesting fact about you. In order for it to be ADHD, the symptoms have to be present and they have to be causing a problem. The last criteria, and sometimes this is a challenging one for clinicians, is that we have to be convinced that the symptoms aren't better explained by another disorder. Again, if you have ADHD only when you're depressed, that's part of your depression. If you have ADHD only when you're anxious, if you have ADHD only when you're doing learning tasks, maybe that's a learning disability. The point is, if you have these symptoms, the clinician, whoever's making the diagnosis, has to achieve some level of comfort that the symptoms aren't better explained by something else. That doesn't mean it's a disorder of last resort, because, as we'll see, it's very common to have both ADHD and depression, or ADHD and anxiety, or ADHD and a learning disability, or all of those. So if those other things are present, we have to be convinced, and there's ways to do this, that the ADHD is independent of the depression that you seem to have as well. So those are the 5 criteria. So any assessment I do, whether it's a brief one or a 15-hour one, it's really designed simply to answer 5 questions. If the answer to these 5 questions are yes, you have ADHD, period. Do you have the symptoms, as I just described? Have you always had the symptoms? Do they go where you go? Are they causing a problem? And are we convinced it's not better explained by another psychiatric disorder? If the answer is yes to all of those, that's ADHD. So what are the symptoms we're talking about? Well, here's the symptoms of inattention. Remember, we said there's 9. You have to have 6 out of the 9 symptoms present for somebody to believe that you meet criteria number 1, meaning you have symptoms of inattention or hyperactivity. A tendency to make careless mistakes, not paying attention to details, for instance, forgetting to put your name on the paper, just a failure really to notice detail. You know, how many times do I have to tell you to pick up your socks? Don't just step over them. I know you're all chuckling as you hear this, you recognize it. The point is, people with ADHD very commonly fail to notice details, and that leads to significant functional impairment for them. Difficulty sustaining attention, you know, focusing on something and then maintaining that focus. Appearing to not listen when addressed. Parents will often talk about learning that they need with Johnny to get eye contact before they start speaking to him, because if they talk to him without first confirming that he's listening, he may be looking right at you, but he's looking right through you because he's not hearing a word you're saying. My children love to tell stories of me giving them permission to do something and then punishing them later for doing something I never gave them permission for, because I actually wasn't there when they were asking. I was thinking of something else or looking at the computer or whatever I was doing. So they learned that they had to get my attention, and that's just something that goes with ADHD very commonly. Failure to finish things. So some individuals, if they're lucky enough to be able to have motivation to initiate tasks, and that can be a challenge with ADHD, are pretty good at starting the things, but not so good at finishing them. Once it's not interesting anymore, it's hard for them to follow through. So I've got a library full of half-read books, and that's not uncommon for individuals with ADHD, that something may interest you, which makes it easy to get going, but once you've lost interest in it, it's very difficult to keep going. And when we talk about the brain associated with ADHD, you'll understand why that is. I want to move along a little more quickly. Difficulty organizing. Individuals with ADHD commonly are disorganized. Avoiding tasks that require sustained mental effort. Homework can be difficult. Again, once something is difficult to do or requires mental energy to do, there is a tendency for individuals with ADHD commonly to be avoiding those things, which can obviously create conflict in families. A tendency to misplace things, lose things, be easily distracted, squirrel, like that, forgetfulness, and misplacing things, as I said. So all of these things, common inattention symptoms with individuals who have ADHD. Now, I want to highlight, when you read the DSM criteria, the diagnostic manual for psychiatric diagnosis, you'll read these symptoms, and at the beginning of all of these symptoms is the word often. That's very important, because often does not mean sometimes. People read these criteria and they say, that's sometimes true of me, that's sometimes true of me. In order for it to be true of you, it has to be typical of you, meaning it's often true. But we want to highlight again, sometimes does not, or often does not mean always either, right? It doesn't mean that it's always true of you. It is typical of kids with ADHD to be able to pay attention sometimes, and there's reasons for that, as we'll talk about. So the criteria isn't, can you never pay attention? It's, do you often have difficulties paying attention? Important to highlight that. And here's the symptoms of hyperactivity and impulsivity. We won't take time to go through those in detail. These are what people commonly think of as being associated with ADHD. Fidgetiness, meaning you're moving even when you're sitting still. Unable to sit still, maybe you're out of your seat in the classroom, don't sit at the dinner table, moving excessively. As kids get older, adolescents get older or become adults, there may be less overt hyperactivity and more an internal restlessness, where you're easily bored, agitated, got to get going, got to be moving, things have to be interesting and moving along for you to stay on track. Difficulty engaging in leisure activities quietly. You tend not to have to ask, where's Johnny? You usually know where he is. A tendency to be on the go and acting as if driven by a motor is what the criteria reads. Talking excessively, sometimes the chatty Cathy in the classroom. Blurting out answers. The last three criteria are symptoms of impulsivity, which means acting without thinking. The brakes aren't working. But they cluster together statistically with hyperactivity, so they all go together as hyperactivity and impulsivity, blurting out answers, difficulty waiting turn, or interrupting and intruding people. Again, these have to be true often. Again, not all of them have to be true. 6 out of 9 have to be true often of you for you to meet this particular criteria. And then if the other criteria are met, that is ADHD. Here's a typical report card. Listen to the report card and see if you can hear some of the symptoms we just talked about. Report card from kindergarten. There are times when he's inclined to be too noisy, especially during free time. Grade 2, well behaved, though at times he does talk and disturb those near him too much. Grade 4, has worked quite well over the past year, and despite his tendency to chatter, has made fairly good marks. Although I think if he cut down on the talking, he could do even better. Good luck and less chatting in grade 5. Isn't that nice? Grade 5, messy work, and this wasn't an English teacher, not good behavior. It's interesting as you read report cards, and I do all the time on every child I see. Teachers have a way of trying to be very positive, and so you almost have to read between the lines at what the teacher's getting at. This is bad behavior, but she says not good behavior. So messy work and not good behavior have affected his performance this term. Good grasp of concept studied, but did poor work on assignments, didn't bother to keep his note work complete. Attention to details. Disorganization. I hope he will apply himself more consistently in grade 6. Grade 6. If a little more careful attention was put into reading, important points would be more easily noted. A little less wasting of class time would be an asset. Mastered the skills, but work habits need improvement. Frequently waste time in class, and as a result, assignments are often incomplete. His written work is often untidy, which causes unnecessary errors in computation. Silly mistakes, again. Major problem has been with novel work, reading, very common problem in ADHD, due to a desire to be outside rather than reading. So these aren't, this is a typical child with mild to moderate ADHD. These happen to be excerpts from my report cards when I was a child. And so, again, it sort of reads like the symptoms of ADHD. You can hear many of them there. What causes ADHD? Well, I could spend another hour and a half talking about this. Here's cutting to the chase. 80% of the chances of you having ADHD are determined by your genes. This is a highly genetic disorder. More genetic than schizophrenia. Very highly. Close to the chances of why you're going to be as tall as you are in terms of genetics. The influence on you having ADHD is primarily genetic. If you have ADHD, you're born with it. It was passed on in your genes. That means, and you guessed it right, it's very commonly runs in families. Where a child has it, it's common for a parent to have it, and vice versa, and siblings. So this is a disorder that's based in genetic influence. We're going to talk a little bit now about the ADHD brain. I'd like to talk about this. We don't have a lot of time to focus on this, but my experience is that as you understand the nature of the brain problem in ADHD, many of the symptoms make sense. For instance, why don't kids get more hyper when they're started on stimulant medications? You give a child who's hyperactive a stimulant, why would you do that? Are they going to get more hyper? And that's not the case, and there's a reason for that. Why can children with ADHD pay attention when they want to? Doesn't that mean that they're choosing not to at other times? No, and there's a brain-based reason for that. Why are they less likely to learn from punishment techniques than other kids? And research shows that's true. How and where do medications work in the brain, and why is reactive anger a common problem? And I want to highlight that. Mood reactivity, impulsive anger, is very common in individuals who have ADHD. In fact, anytime somebody has a significant anger problem, somebody should take time to make sure they don't have ADHD, because that is a common association with ADHD. In short, you can think of reactive anger as the mood equivalent of impulsive behavior. When we talk about being impulsive, we mean you act without thinking. What's supposed to happen is you get an impulse, you think for a split second about whether you should, shouldn't, what happened last time I did this, what's going to happen if I do this, and then you decide whether to act on the impulse or not. If you're impulsive by definition, that middle step is missing. You get the impulse, you act on it, and then you make up a good story to defend yourself. That's usually how it works. But kids with ADHD, adults with ADHD, are very commonly emotionally impulsive as well, that they tend to feel without thinking, if you will. The braking system isn't working as well. So that's one of the things that's wrong with an individual who has ADHD very commonly. There is an area of the brain, we can't go through all the details of the brain-based research, but there's a couple of areas that repeatedly come up in brain-based research as it relates to ADHD. One is the caudate nucleus, and this has to do really with the braking system in the brain. It has to do with putting tone and intentionality on our behavior, choosing to do things rather than just immediately doing them as soon as you get an impulse to do it. Most individuals, as we said, put the brakes on and have time to think about what they're going to do or how they're going to react to something. When you have ADHD, if you have hyperactivity and impulsivity, it's related to a part of the brain that is underactive, and that's very important to highlight. The problem in these areas of the brain with individuals who have ADHD is that these areas are underactive. That shows up in imaging studies that are done, functional imaging studies. And when the child is placed on medication, these areas become normally active. So why does a child become calmer when they're placed on a stimulant medication? Because the problem to begin with is the braking system. So it stimulates their brakes. It returns their self-control. It does not work by sedating them. It works by returning their own natural, normal self-control back to them. And that is the intention of that treatment, and that's how it works. There's another area of the brain I want to talk about briefly, because this explains some of the confusing symptoms as it relates to ADHD. Why can they pay attention when they want to, for instance? And that has to do with an area called the prefrontal cortex, the front of the brain. This area of the brain is what's commonly called the executive of the brain. It helps choose and plan and influence what you focus on and what you don't focus on, and then anticipating and planning activities. So before I talk specifically about the prefrontal cortex, it makes more sense if you understand another area of the brain that isn't a problem in individuals who have ADHD. Right above your ears is an area called the parietal lobe. This area is responsible for noticing things. Things that are bright, things that move, things that are loud, things that catch your attention. are first noticed by the parietal lobe. That works perfectly fine in individuals who have ADHD. They notice things that catch their attention, like everybody does. They're more likely to notice things that are bright and moving and loud and interesting than things that are boring, like if they're not interested in school. If they are interested in reading, that might catch their attention, and they might find it easy to focus on that. But everybody finds it easier to pay attention to things that catch their attention. Everybody, including individuals with ADHD. Things that are bright, things that move, and things that are loud are easy to pay attention to. So it makes sense why things that are bright and move and are loud are very easy to pay attention to. Why do kids with ADHD, who seem to have difficulty paying attention, find an ability to play video games for 4 hours straight, but can't do their homework for 5 minutes? It's because that area of the brain, the area that notices things, that attends to things that automatically catch your attention, is not a problem in individuals who have ADHD. The area of the brain that is a problem when you have ADHD is the prefrontal cortex. It's that area of the brain that is responsible for moderating what happens in the parietal cortex. It's this area of the brain that is supposed to tune up low signals, like books if they're boring, and tune down loud signals, like video games, if they're interesting. You can see it. You watch your child do homework. You can see that out of the corner of their eye, the video game is calling their name, because that area of the brain, the parietal lobe, is catching the attention of that. If something moves, they notice it. What's supposed to happen in the average individual is our brains tune down things that right now aren't important and tune up things that right now are important that we want to focus on. So if I want to have a conversation with you, there's a hum in this room, there's bright lights, there's a memory from what happened, there's the pressure of the seat on my bottom. All of those things, as I mention them, come to my attention, but my brain tunes them out so that we can focus on a discussion. If that area of the brain's not working, it's hard to tune out things and tune in things. And so that's why kids have the kinds of problems that they have. There's a myth in our society that ADHD is created by environment, specifically bad mums. The fact is, it's based on some research. Here's what we know. When we study mums of kids who have ADHD, on average, not true of every mum, on average, mums of kids who have ADHD, I don't know why we study mums and not dads, who knows, maybe because they're around the kids. Mums of kids who have ADHD are more likely to impose control on their kids. They're less likely to respond positively when the child is complying. They're more likely to use coercive, invasive techniques to gain compliance. They're less likely to initiate social contact, and they're less likely to respond to the child's attempts to initiate contact. On average, repeated research shows that tends to be true of mums who have kids who have ADHD. So society concludes, and unfortunately some clinicians and book writers conclude, bad mums create kids with ADHD. Well, you got to keep looking at the research, because that calls into question some of those thoughts. You know what happens when the child is treated? The mum becomes like any other mum. Interesting. We also see that it just doesn't make sense in terms of the genetic facts that we know, right? That ADHD is associated primarily with genetic transmission. That doesn't fit with this whole mums cause ADHD theory. There's a line of research that shows that if you take a child with ADHD and give them to a mum who doesn't have ADHD or isn't stressed, they become like the first mum does. So again, you treat the child, the mum becomes quote-unquote normal. You give the child to a quote-unquote normal mum, and they become just like the stressed-out mum, if you will. Also, if the theory is that mums are stressed in their lives and they pass that stress on to their child who ends up with ADHD, then you would expect the best predictor of how stressed mum is to be what's going on in her world, because that's the theory, that she gets stressed and passes it on to the child. In fact, the research shows that the best predictor of how stressed a mom is how well the child's doing. So it doesn't seem to be the case that bad mums create kids with ADHD. It seems to be the case that kids with ADHD very commonly bring out the worst in us as parents and teachers and doctors, etc. So there is a statistical association, to be fair, between quote-unquote bad mums and kids with ADHD, but the cause arrow is the opposite of what most people think. There are a number of other proposed causes that we won't take time to go into. The research shows that these just are not the case, but I want to highlight them just to say these are not the cause of ADHD. Toxins, television, Sesame Street, parent management problems, diet and nutrition, our culture, allergies, these don't cause ADHD. Now, to be sure, all of these things make anybody do less than their best. That's different than saying you could take a child who doesn't have ADHD and give them ADHD by exposing him to these things. The research shows that that's just not the case. So we talked about ADHD, we talked about what the nature of it is and the diagnosis, excuse me, I'll just take a drink, and we talked about the cause of it. So let's talk about some of the other things associated with ADHD, and I have to move along. I've got 5 minutes to wrap up. ADHD is very commonly associated with many other problems that aren't part of the diagnosis of ADHD, but are very common in individuals who have ADHD. Social skills challenges, emotional reactivity, we talked about that. There's a tendency for individuals with ADHD, it seems, to be more personally sensitive than other individuals, meaning that it takes less to affect their feelings than it does for the average person. And this is not true of everybody with ADHD, but it tends to be more true of individuals with ADHD than those who don't. So it's like they're more easily hurt, if you will, or more easily affected than the average person. Working memory problems, we could, again, spend a whole lecture talking about this. This is the short-term memory that has to do with holding information in your brain long enough to use it. Going into another room and then forgetting, why did I come into the room again? I give you a phone number, you go into the other room, you're supposed to remember it long enough to use it. Motivational difficulties are very common. Family conflict is very common. It is unfortunate that in this province, as in most places in North America, probably the world, when families with children who have ADHD present for help, the most common referral that occurs is for family counseling, as if that is the original problem here, when in fact it is the effect, it is the side effect of the problem, which is ADHD, and the ADHD tends not to be recognized. But family conflict, very common in ADHD. A tendency to be prone to injuries and accidents. I told you about my experience and ICBC's love for me. Co-occurring disorders. These are other psychiatric disorders that are not ADHD but are commonly present with ADHD. Again, you'll get instructions if you don't have them already on how to download these slides and get a copy of them yourself, so I won't take time to read this out. Many other psychiatric disorders, very common with ADHD, anxiety, depression, oppositionality, very common. In fact, 44% of kids, adults with ADHD have another psychiatric disorder. 32% have 2 psychiatric disorders, and a full 11% have 3 or more other psychiatric disorders in addition to ADHD. This isn't a disorder that is just by itself commonly. I want to briefly go over this, although again, this is a subject of a full talk, because this helps you understand why you shouldn't approach ADHD a certain way and why you should approach it another way. I call this the ADHD road. We know everybody who has ADHD has problems with inattentiveness, hyperactivity, and impulsivity by definition, because if they don't have ADHD. We know that they commonly have problems with social skills challenges, emotionality, other difficulties. Psychiatric disorders are very common. All of these things lead to difficulties in functioning for the individual. That's true by definition again, or you don't have the disorder. It has to be interfering with your functioning. So we know individuals with ADHD are born through no fault of their own with certain symptoms and difficulties that lead to problems functioning in many areas of their life, in the family, in school, among their peers, and that leads to chronic difficulties with a child and adult constantly going through life, chronically experiencing negative feedback. I'm messing up, I've messed up again, I'm frustrating people, I must be dumb, etc., etc. Well-meaning parents will say, hey, we can cope, we can manage, we're going to sort of grin and bear it because we love our child. That's excellent. The child still goes through life knowing that their parents are coping with them, right? Kids are smart. They pick it up. They know that the impact of their symptoms on themselves and on their functioning is leading to difficulties. They see their own difficulties and they go through life with this. That leads to them trying to cope. And the way they cope is the way all of us cope. You build a wall so that it doesn't hurt anymore. And so this wall of protection is very commonly built in individuals who have ADHD. It's sort of a psychological wall, if you will. It might be coping strategies like humor to keep the world light. It might be a chip on the shoulder, an attitude to kind of keep people at a distance. The point is they're constantly going through life getting negative feedback. Parents will sometimes say, you know, it's like he doesn't even have a conscience. Well, what is a conscience? A conscience would be one more negative voice telling them how they're messing up. So they can't afford to hear their own voice telling them that they're messing up because they're constantly seeing this happen and getting this negative feedback, again, through no fault of their own because of the difficulties with functioning. In my view, it's this process that's most concerning, even more than the core symptoms themselves, because this is what sets a child up then for difficulties in life more than most other things. That's what leads to oppositionality, conduct problems, difficulties with the law, challenges in terms of relationships, substance use problems as they try to cope. It's as a result of this wall that they build to protect themselves from the chronic onslaught of negative feedback. Why do I highlight this for you? Because if you understand this, you will understand this is not the treatment for ADHD. They do not need to learn some discipline and to go to boot camp. They do not need to be reined in and controlled in a manner, because what's going to happen with this child if they have ADHD? The wall's going to get thicker, right? They're going to protect themselves more and they're going to be set up even more for challenges. So I want to just say a couple brief words about discipline. We attempted several months ago to do a broadcast on collaborative problem solving. So write that down. I don't think I have a slide on this. The term collaborative problem solving, you can Google it and learn about it. That's an approach to dealing with parental concerns that I recommend. I do not recommend what is traditionally called discipline. Why? Here's why. When we're talking about discipline, we're typically talking about rewarding and punishing kids, what we call behavioral strategies. The fact is, there's lots of research that shows behavioral strategies work. Hold it. So you're telling me behavior strategies work, but then you want us to not do it? Why? Well, here's why. When I do a talk for parents, I will usually pause here and then put up a slide like this and ask parents to tell me what that is. Usually there's silence. I give it a little more time. What is that there? And most parents will not respond. I have yet to hear a parent respond and tell me what that is. So then I'll say, I will give $1 million to anybody who can tell me what that is. Still nobody answers. Okay, anybody who can't answer what that is right now has to leave the room, and you have to put $100 in the box on your way out. I'm going to punish you, in other words. You still can't tell me what it is. Well, it's sillies. It's the directional derivative. My son taught me that one. The point is simply this. All the motivation in the world, rewarding and punishing you, isn't going to give you skills you don't already got. I can't reward and punish you into learning skills you don't have. And if the problem is that you're lacking certain skills, as we said, ADHD is brain-based. It's genetically determined. If they are born having difficulties paying attention, motivating them to pay attention by rewarding and punishing them, A, is not going to be real effective. B, it's likely to create some difficulties. Remember, we talked about the wall, the protection wall that they build. You see, rewarding and punishing only influences motivation. It doesn't teach skills. It tends to work only as long as you use it, and it can have very serious side effects. Negative affective pairing is just a fancy term to mean you want them to make their bed, you're associating it with lots of punishment, you're making their bed a pretty negative thing in their mind. It's not a happy thing to do. It damages relationships. Parents tell me all the time about how they go to parenting classes, learn discipline, they go back to the parent class and say it didn't work, and they're told, oh, you didn't do it right, or you need to do it harder, and then there's more difficulties in the relationship. Why do I tell you all that? Simply this. The approach to treatment for ADHD has two components. Number one is intervention at the consequence side, the effect of the symptoms. So people are born with ADHD, they are born with symptoms that cause them problems. You want to minimize the impact of their symptoms and the consequences of their symptoms. So if we want to help parents, we want to help the child or teen themselves or the family or school intervention, it's to minimize that impact of their symptoms, of functional impact, and the negative consequence, the negative feedback that they're constantly getting, so that they're not constantly getting this negative feedback on their self-esteem. But there's something else we have to do. If we keep doing that, you can't control the entire world. If we're not doing something to reduce the symptoms that are leading to the problem to begin with, we're probably not doing them a favor, because you can't control the entire world and make sure nobody gives them any negative feedback about their symptoms. It's going to happen. So for everybody with ADHD, the research is pretty clear. We need to reduce the symptoms if we can. And that's usually done by biological interventions. And I use the term biological generically. We can talk about natural remedies, although we don't have time. We can talk about medication. I will go over that very briefly. Because usually parents are interested in that. Natural remedies are becoming popular. There's some anecdotal evidence that it helps some people with ADHD. Johnny's second cousin, twice removed, got better when they went on FLX Focus or something like that. There's evidence like that, but there isn't well-designed scientific evidence showing. We actually contacted one company and offered to do some study to see if it would work, and we were told that there wasn't interest. The point simply being that there isn't scientific evidence supporting the natural remedies are working as well as some other remedies might. They're symptomatic, they're not curative. That's not bad. They just treat the symptoms. They don't cure ADHD. And side effects can exist. I've been on some of them, and I won't talk about the side effects we had. Some challenges can exist. That's not bad. Side effects don't mean bad things. Side effects just mean it's an effect that wasn't the intended effect. It's a side effect. That's all. It doesn't mean it's dangerous or not dangerous. Headache, upset stomach might occur. Nausea with these, but that's fine. And we don't know how they work. Medication, we have a lot of information about the medications used to treat ADHD. These are among the most studied medications in all of medicine. There's, unfortunately, but fortunately, the controversy around ADHD leads to many eyes looking at ADHD and its treatment. What we know about these medicines, we know. They've been around for many decades, and so we know what we know about them. We tend to talk about stimulants and not stimulants. Again, they're symptomatic and not curative, right? They don't cure the ADHD, they treat the ADHD. Similar to me wearing glasses. I still have bad eyesight, but my bad eyesight is of no consequence when I wear my glasses, which treat the symptoms. The medication used to treat ADHD is like wearing glasses. It reduces the symptoms and the impact of the symptoms on the individual's functioning. They still have ADHD, but that's not a bad thing. We just need to admit that it is what it is. And then they work by increasing the underactive areas of the brain, as you can see here. This is sort of two brain scans showing a child on medication and then off of medication on the left. You can see that areas of the brain that are underactive have become active as they're on medication. We won't have time to go over individual medications that are available currently and used to treat ADHD. Just suffice it to say this, it's probably best to think of them as stimulants and non-stimulant medications. As you can see, the top two rows are stimulant medications. Methylphenidate and dextroamphetamine are stimulant medications, and the non-stimulant medication currently available in Canada is called Strattera. Stimulant medications are more commonly prescribed first. They're more likely to be effective, more likely to be tolerated. That doesn't mean they're for everybody. It just means we tend to start with them first. And I've shown the duration of action because the research shows longer acting medications are better than shorter acting medications, both in terms of how effective they are on average, not necessarily for Johnny, but on average, and are better tolerated as well. So we tend to go with longer acting stimulant medications first, and if that's not working, then we move on from there. I can tell you lots more about that, but time is out. Side effects are nuisance side effects. The side effects are not dangerous side effects to these medications. They are safe. They are not addictive. The growth suppression is not an issue. You hear all kinds of concerns around that. And again, it's available in shorter acting and once-a-day preparations as well. I want to dispel with this myth before we wrap up. Children treated with stimulant medications, Ritalin is an example of an older stimulant medication, is still used and still effective, are not more likely to get into substance use problems. In fact, kids with ADHD are more likely to get into substance use problems, and the research shows, contrary to myth, that by putting a child on a stimulant medication, you reduce their chances of getting into substance use. You don't increase their chance of getting into substance use. It's the untreated ADHD that makes them more likely to get into substance use problems. So many parents end up out of natural, normal, and understandable anxiety, given the myths that are out there. They withhold medication from their child out of worries about the outcome. That often leads to the very outcome that they're worried about preventing, and so it's something for you to consider there. They work simply by reducing the symptoms, which leads to improved functioning, because it's the symptoms that are causing the problems with functioning. It improves social skills. All of these things that I've listed here are research-based. It improves self-esteem, significantly improves family conflict as the ADHD is treated, reduces the risks of the secondary problems like depression, anxiety, etc. So in summary, and I'm over time, I apologize, ADHD is a neurobiological disorder. It's based in your brain. It's associated with other difficulties that all lead to challenges for an individual who has ADHD. It puts the child at risk for negative outcomes later on. That negative outcome is partially mediated by the experiences they have in life. And so as parents, the task is to try to make sure as best as possible they are experiencing positive experiences, minimizing the impact of the ADHD where possible, pouring on the positive opportunities for them to experience success in life, which will counterbalance the natural tendency for the ADHD to lead to difficulties. And then your views, your perspective, the lens you look through when looking at your child's behavior is very important. It's important that you're telling yourself, my child has a problem, not my child is a problem, and then interacting with them in a supportive manner. That doesn't mean you don't have expectations. It's what you do when they're not meeting your expectations that changes as a result of that lens. And then the treatment usually involves more than one thing. And almost always, the research shows, I said almost just to be conservative, virtually always it should include treatment with medication, because that's something we can reduce, and we know that's what's leading, that is the symptoms, are things we can reduce, and we know those are what's leading to the challenges and the risk later on. So thanks for listening, and I've gone over time, so any questions I'd be happy to answer.
Yeah, well done. That's a lot of information.
I told you I'd speak fast.
Yeah, you did, but there's a lot of information, and I think we'll take one or so question, but I think most communities will probably want to discuss amongst themselves what's worked and what hasn't, in terms of if you go to a doctor and they say, I don't think your child has ADHD, then what do you do, or where would you go? Probably parents comparing notes, hopefully in community groups, is one way to discuss that. Also, I think a lot of parents out there would love to have partaken of that study where we could give our kids to these good parents yes. and then feel very validated that, in fact, those good parents yep. who, mistakenly have judged may, in fact, have a real learning curve. So that, I think, would have felt pretty good for me way back. One question we have here is, and I don't know if you can answer it in like 2 seconds or less, sure. but how can ADD kids be set up for success at college or university?
Well, first I want to, I have a bad memory. The working memory I talked about is a real problem for me, so I'll forget the question as I start talking here. The first thing I want to highlight is the setup for success. That is, in my view, the primary parent strategy. Life through ADHD has set your child up for challenges. The negative feedback that we talked about, that's what's going to cause problems for them. Consider it your test to set them up for success, meaning pour on any opportunity to see themselves succeed. It's taboo to use for punishment, if you use punishment, something that they get positive self-regard from. If they're really good at soccer, pour on soccer. Don't use it as a carrot or a stick, as is tempting to do as a parent, because that's their lifeblood in terms of seeing themselves do well. We can all cope with our own difficulties if we can tell ourselves. Remember we talked about the conscience, and the child may not be able to afford to be honest with themselves about their challenges. It's easier for all of us to be honest with ourselves if we can whisper to ourselves, yeah, but I'm good at this, I'm good at that. If we feel like we're failing at everything, we're going to be less likely to be honest. So the more you set them up for success, the more easy it's going to be to have an actual discussion about the difficulties they're having, and they won't feel the need to protect themselves and guard. So specifically, what can you do in school? That's a difficult time, a transition time as they go to college, because most of the time parents have participated in helping them and carrying them along and doing what it takes to help them graduate. And as they go to college, very often that's not available, and that's when kids sort of fall down. So we talk to colleges and universities about the need for support programs, screening programs as kids are transitioning. Get them connected with the counselors at the school, because very commonly, it's actually a human rights legislation challenge that has resulted in an obligation for colleges to accommodate kids' disabilities. That's still yet to be challenged in school, although in elementary and high schools, although it applies. Colleges have recognized they have a legal obligation to accommodate disabilities. And so they have strategies in place typically. Make sure they're connected with the support programs, student support. They may have available certain strategies, may accommodate longer exams if they have difficulty, may be able to write their exams in a room by themselves rather than in an open hall, which is very distracting. So those kinds of strategies may be something the college will be allowed. And then being available and supportive. The question itself highlights one of the things for parents to keep in mind as kids are growing up, that whatever you do, you want to maintain a position with them where your opinion matters and your relationship with them is maintained, because you're going to need to be available for them on an ongoing basis, at the very least for emotional support, if not for really tangible, concrete. So I haven't been very specific, but connection with the support systems that are within the college, and they should exist in the college. And then talk about transitions and be available for phone calls, reminders. I always tell kids to ask for reminders if you have a problem with memory. Just recognize it as a problem with memory, because reminders you ask for are help. Reminders you don't ask for are nagging. So ask for it, and it'll feel a little better, and it'll be easier to take. So encourage, just recognize that it's a real problem you have. It's not that you're a problem, you have a problem. So get some help, and if your parents are willing to help you out, it's not their responsibility to, carry you forever. If they're willing to help out, great, take it.
Great. Well, thank you very much. You've answered a lot of things in a very short period of time, and there's lots of food for thought. And I guess resiliency building, self-esteem building, parent connection, and focus on catching your kids being good, so to speak, is a good way to sort of simplify it. And so good night, everybody. And next month's session is the involving dads. So I'm sure all us mums that have listened to that study are now going to drag their husbands or whatever to the next session. Thank you.
Thank you.